That is before. You will see after, okay? She is the model for Please Skin. Please Skin, right? This is our trainer, beautiful.
Thank you.
Yes, what's her name?
Hazel. You can call it
Hazel.
Hazel or
Hazel.
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 Which one is easy?
This is training for Please Skin. Our training is Chuba Chuba.
That's her name?
Yes, that's her name, Chuba Chuba. Apple.
Are you ready?
Her name is Apple.
Apple.
Yes.
Oh, cute. Apple, where are you from?
Philippines.
Philippines. I would love to go there one day. Yeah. Okay, so I'm gonna start cleaning her skin first with my Play Skin Foaming Cleanser. It has 2% of salicylic acid. So we use this mostly for the oily and shiny skin, and I'm not gonna put it.
You want to go over her. Wait, I will go over the head.
Do you have something like that?
No, I will go over the
Cover the bun. That is, she's Maricar.
She's perfect.
She is Maricar.
Marika, you know what to do. You're a problem saver. Solver. Okay, so Apple, I'm gonna clean your BB cream.
Yes.
And
If
then
I know, I didn't put anything. I don't know.
yeah, if you want, I have BB cream with me. I will put it again.
There's a tissue. You want to wipe her hands.
Clean the with cotton.
Yes.
Removing the BB foaming wash.
I will do it one more time to make sure.
It's clean.
Good comment. Okay. Now I'm gonna start. Oh, first I will do. Okay, let me do this. Take the
Tissue.
remaining redness.
Dry with tissue.
Because I will put oxygen mask.
Oxygen mask. Second step.
So this is my oxygen cleanser. It will give her micro capsulates of oxygen into her skin. And you will see now. We are not gonna massage it. You see, I just put it and leave it. So this Apple, do you feel tingle on your skin? Little bubbles? Yeah, that is microcapsule of oxygen. So right now they are popping. If you can come closer, you can see the pops. This is going in, and you can hear it. You hear it? I hear it in my
Ayan. The bubbles is
Uh-huh.
How many minutes
Popping.
will you do it?
3 minutes is enough.
3 minutes.
Mm-hmm.
Then wash it.
Popping. Yes,
Yeah.
and then I will wash it.
Remove by cotton only with
Yes.
water.
There's cotton here.
This.
Wet cotton.
Ah, great. After the bubbles are finished, you can do like this one more time to see if it's gonna bubble again. Sometimes it does, sometimes it doesn't. Now her skin has oxygen and it will take everything we will do much better.
So everything we will put, it will be absorbed easily
Exactly.
with the skin.
Exactly. Laura, are you there? Okay. We are having fun with girls. Are you ready? I'm not gonna hurt you, don't worry. I hope. I hope. So, as you know the device, but I will show you how to do it. So, our device has 3 options. It has the mode, the speed, and the quantity. The mode, we always use it in dose. I will show you the other mode too later. Speed, we will always be in normal. And quantity, for the face, we go 0.030 ml. For the hair, we go 0.040 ml. So if you mostly work with the hair, you don't need to change those two. You will, if you want, you will only change the mode. How we're gonna change anything in the machine is, you see this arrow? So we go with, press this arrow, and it will become white wherever we go. So I go with left, right, speed is white now. I go right, quantity is white now. I go inside the quantity, I press the arrow again. I do the changes, and then I go with the arrow again. Arrow is like a confirmation. So you,
Like a home.
yes, you started exactly. I started, I go with the mode. Left, right, again right, I go with the mode again. I press it, I go inside the mode, I can change it to continuous or again those, like this, okay? And this button is the button that we are gonna use every time we apply the machine.
The flame.
So, I take out the blue cap. This blue cap is very important. Without this, it's not gonna work. It's like a safety seal, okay? I put it there. So, this button takes the thing out if I press and hold, and the other one makes it go back, okay? So, everything in Play Skin is screw. What does that mean? You screw it, okay? Like a screw. I'm not taking it like this to open. I always turn it. Very easy. To put here, I always turn it. Always be careful with this thing a bit out, okay? While you're putting this, and then I put it. Okay. Now I'm gonna press this to make it go back. Sit. Okay, now it touched the ground. Now I'm gonna put my blue cap again. Now I'm ready. So in here, well, we're gonna put the needle. I have 2 ways. Again, I have turn it and open it like this, or I can take this out completely. What I suggest personally is don't use it like this, because this part is delicate. So sometimes when you put the needle a little bit fast, it can break. So always have this. Thank you. And okay, I turned it out, it came out. This one is 1.2 millimeter, very small, but it doesn't mean it's not gonna work. It will work perfectly in the skin. And if your customer has a mature and thick skin, you can go with the 2 millimeter. It's painful just a little bit, but beauty is painful, right? So I put my needle. Okay, not too much. That's okay. Now, here's an important part. I will show you. Try to press it like 4 or 5 times until you follow here. You see the serum is coming. Every time I press, it's coming. Like 6 times. Now I can see it. You see it, right?
Yeah.
That means I can ready. But if you do it on the skin, it will be unnecessarily pain. Okay? So now I'm ready. Are you? I always scan the skin from here, like that. Okay, here. And then I go with a
How
little
many
bit.
needles that one?
5 needles. But you are not gonna have any pain, don't worry.
Micro needles.
Yes. And if you can go always here, right there, if there is like wrinkles, okay? But forehead is the most painful part because it's a very thin skin. And if your customer doesn't need it, you don't have to go there, okay? So mostly we work with the cheeks. And right now, because she doesn't have like deep wrinkles or anything, I'm not gonna press it more than once. But normally, if you have like in here, nasolabial, you can go 3-4 times to make it open. Or here you can go 3-4 times, and you can scan the skin again. Her face is small, so I think we're gonna use only half of it. But let's start. So degree is very important. I always go like this, okay? Not like this, not like someone was doing like something like this. No, I go directly. Apple, you have any pain?
No.
That's all you will experience. You see? Oh, very important. Now, listen the beeps, okay? 2 beep. I put it, press, 2 beep. Do not take it out before you hear the 2 beeps, okay?
Don't remove it.
Because 1 beep is pushing and the second beep tells you, okay, it's done. If you take it out without hearing 2 beeps, the serum will not go inside. Okay? Every time I push, beep, beep. Micro bleedings are completely normal and a part of a process. And when you scan, you always let it absorb the remaining on the top. For example, if we're working with the acne skin and it has active acne, we don't pop the active acne. We always work next to it, because if I pop the acne with my needle and then I will smudge it everywhere and it will make it worse. So because of the liposome technology inside this device, this serum, the serums will go to the problematic area. Even you don't have to put it to the active acne. For example, let's think about this as an acne. I don't go like this, I go like this.
Besides.
Next to it, yeah. You can go here, here, anywhere, but it will also go and heal that acne anyways. So we are not popping it. DNA and hyaluronic acid has immediate results. You can see clearly from the first session. But hair, melanin, and acne is of course, procedure is a treatment. So we need at least 6 to 8 sessions, especially for acne and melanin and hair. Hair is the hardest one, but the hair results are amazing. As you can see, I'm scanning the skin all over. Are you okay, dear? Yeah, she's sleeping, you see? No pain at all. You're red like a watermelon, but it's gonna go.
Because I'm sensitive also.
Yes, I realize it.
Cry.
Also, it's very fast, as you can see. When you know how to do it and you do it like a couple of times, the procedure, only the meso, will take like 10 to 15 minutes. But of course, we're not sending the customers in 15 minutes. We have like ritual, cleaning, peeling, whatever you do, and then you can finish your session in 10 to 15 minutes.
That is normal, the blood coming.
Yes, blood is a part of the process. It's like micro bleeding, but it won't happen in every customer. Apple is a little bit sensitive skin. As you can see, she is red. Normally, in 90%, you don't even have red, but it will go away. For example, if your customer has a very sensitive skin like this, if you have masks, cool-off masks, you can apply after this. Even you can put ice, but it will pass very fast. Would any of you want to try? Come. You can work with the cheeks. Great. Do you think it's going down?
Far from the
I think you
skin,
should
like
more.
press a bit more.
Press down.
Do you feel Apple? Say something.
No,
No?
it's very soft.
Yeah, press a little bit more. Now? Yeah, I think you got it right. Underneath your hand, you will understand it. Yeah.
Oh.
She is afraid.
Yeah, I know she doesn't want to hurt you.
She's afraid.
You're good. And good. I will do it. Yeah. You can always spread the remaining.
Him also.
شوفك يعني مستنية اللحظة دي.
You can also work here too. Mm-hmm. Great. You can go with the right cheek.
Here.
Mm-hmm. Yeah, that's the maximum level that we go underneath the eye, okay? You can go like here, not the under this eye back.
I'm scared.
No, don't be. You can turn her head. You can always make sure. I think she's fainted. Apple, are you there? Okay, she's here.
Here.
Yeah, you can go there. Try always put the 5 needle at the same time. That's the important part. Mm-hmm, exactly.
Your hand is shaking.
Because all it's red here. I'm here.
Mm-hmm.
We can
Yeah,
give her little,
that's your last part. When you believe it's done, you scanned everywhere and you think like you scanned it enough, and then with the remaining serum, we will make an active massage. So in that part, we will see the continuous mode.
Thank you.
So I thank you. I press the arrow, right? I go with the mode inside it, and I change it to the continue. I couldn't, but now I did. Yes, continue, okay? So I'm done with my needle. So what I'm going to do is carefully put this in so I won't hurt myself. Take this out. I broke it, you see, because my hand's slipping. So now I'm in continuous mode, right? As long as I hold this, look what will happen. Okay. It will push all the way. We only don't do active massage in acne because, as you know, we don't want to activate the acne with active massage. But for DNA and hyaluronic acid,
But if someone have skin like me, like I don't have active acne right now, so we can do like this massage after.
you can if you are not going to activate any acne underneath it. I think yours healed,
Yeah.
but it's only scar, so you can do it.
Okay.
Now I'm gonna put a finishing cream, anti-aging lifting cream with the same series. This one is our favorite. Botox effect Mesolift anti-aging cream. This one also has a professional size for your cabin, but for today I bring this one. So you can buy it cheaper and put it on your cabin for your finishing cream.
But it's normal, just like it's hot feeling.
Yes,
Yeah.
yes.
Redness.
Normally, I highly recommend a cool off mask or something to cool off for very sensitive
mask.
skin. Soothing mask, exactly. But even if you don't have it, this will go away very fast. This is, I think, for one of the most cases that I see this much of a redness because you're sensitive.
And what about the post care?
Post
After this
care.
session?
After this session, we don't recommend to wash your face at least like 6 hours or before you go to sleep, until you go to sleep. And then we have home care serums that is helping the process to get better. So we suggest our customer for the home care serum, and then she can use that serum every morning or night depending on her regime, or only morning or morning, both of them, it doesn't matter. And I always recommend this cream and the serum together for like anti-aging or hyaluronic acid.
Let me show you how the serum
yes.
looks. It's in the back there. I will take it. It's okay.
I'm done already.
So you know we have 5 types of cocktails. We have hyaluronic acid, anti-aging, DNA, pigmentation, acne, and
Hair.
the hair. So for each one, you will see similar serum. Okay. So the patient, the customer came and she did, let's say, for acne. So once she finished, you recommend for her that she can then use this home, and it's available where it's here, so she can buy it directly from your place as well. Okay, so you recommend for her. It has the same active ingredients that she did for in the session dear. Exactly. And there are all types, so whatever procedure she will do, then she can take with her the serum. So it's the best thing if you recommend for them the serum as well. They will have nicer results. They can directly buy from here as well, so good profit. And
It's like a mini session at home. They are doing
exactly to enhance their results. To enhance their results. I will give. No need. We'll give you samples, my dear. We'll give you samples. You don't need to buy anything.
Yeah.
So we'll give you, like, see, this one has the samples for all types. This is the one that you did now, the hyaluronic acid. You will find also for the hair. You will find here also for the cocktail, for the eye also. Everything you will find here, different type of samples here. Okay?
I also want to show you how to finish this, take this out. So after we're done, I take the blue cap, okay. Again, screw. It doesn't need any more, but screw, okay. You take this out. And then I have to make this go back again. This holding this.
Yeah, it will go back.
3 hours later.
You have to be patient.
Yes. Be patient.
Yeah.
Now you're done. And it will close automatically in like 1 minute. And when you want to open, again, if you press any button, it will open. It will take 3 hours without charging. You can use it. And then after, on the right, you can see the battery.
Okay.
If you think that,
Because Farina is here, she will just to talk to you quickly. She's just need you.
Okay, I have training. You can have 5. We
we're
finish.
done anyways. Yeah. Just a couple of more minutes. If you, it comes with the box, you have the charger. If you think it's finishing, you can put it on charger. That's it. Any questions, ladies?
So far, no.
Good? Yeah, everything clear?
Clear.
Okay.
How are you, my dear?
Still red.
It's way better.
Yeah, let's see.
It's going out. It's leaving.
It looks nice.
disappearing.
It does, really, my dear. It looks nice. And then you will put the serum.
Yeah.
You will be perfect.
Yeah, the same the paper.
For what that one exactly? The play skin?
For what?
For what? For what? For
Uh,
wrinkles or
For what is the
pimples or
benefit?
Anti-aging, acne.
All of them.
Yes,
Different
five
all of them.
different, five
Different.
different
Yeah.
solutions. Basically, it's a mesotherapy line, and for this mesotherapy line, we have acne protocol, melasma melanin protocol, hair protocol, hair growing. For example, for patients who had cancer in their past, they lose their hair, they lose the the strong grip of their hair. It will come back. And I have DNA lifting. It's like one of our star for the flash effect in the anti-wrinkle, deep wrinkles. These are nothing. Bring me someone who has deep wrinkles, and then we will see the results. You can always try it like that because you can see the results in one session for sure. And for the hyaluronic acid, again, a dull, like a
Dry.
smoking,
Yeah.
dry, dull skin. Just put it, and it will be shining. And she's shining right now.
and how many sessions before the the wrinkles?
For the wrinkles, we recommend 4 to 6 sessions. So it depends on your patient's skin type actually. So for the first 4 sessions, we do every week, okay, 1 time every week, and then 4 weeks later, you just examine the patient and you can say, okay, for the next 2, I need you for 10 days in a row.
Okay.
And that's like a very, very, very big progress.
So the wrinkles is not come back.
The wrinkles will come back because you are getting older.
So must be
but-
continue.
Yes,
But not like every week, every month.
Every
kinda.
6 months, then she can repeat the
Yeah, like a
protocol,
Botox.
you know?
Like a
Botox.
Botox.
It's only for certain time.
Yeah.
But you just need to put your creams and serums
Of
to
course.
support it.
Yeah.
And then, as like a Botox, you can do it in 6 months. And the procedures, protocols, like hair, acne, and melanin, yes, they will go away, of course. And you don't, for example, did they see the picture? You didn't see the picture. Wait. I will give you the
Usually,
catalog.
most.
I have
what the most
wrinkles
common
more.
problem you
Wala
have?
ako.
Yeah, usually, what is the most common problem you get? Hair loss.
Hair loss,
acne,
yes.
Hair loss.
A lot.
Hair loss a lot. Because weight loss, usually your patients come and
Yeah.
they lose a lot of weight, and it's usually related to the hair loss.
The
So-
skin and hair.
So one of the treatments that you can always recommend for them easily, hair loss. And what you're doing for them hair loss, tell them you have some wrinkle, I will
You
give
see
for
this
you
picture?
DNA.
That's my face. From profile, you can recognize me.
Really? Mashallah.
Yeah, this is 5 sessions, 5 weeks.
Okay.
5 sessions, 5 weeks. I had active acne and they won't go away. It was like my 27, 26, so I was not a teenager. After 5 sessions, it became like this, and it will never come back to this again. So it cures you underneath your skin.
So the acne one, it also heal the scars like.
In very different, we were not expecting this. It scarred, it healed some scars of mine, but my scars were from a car accident. When I was younger, I had a car accident. But still, if it can heal that scar is scar. You know?
For the acne scars.
It will work. Yeah.
Will help يعني will help.
Will help,
Will help
exactly.
definitely.
So I can give you this. You can have it. Anything you need, you will have Lara.
Yeah.
Lara has me.
You can only just take my number. Just put it so if you have any questions.
What's your mobile number?
33 60 31 19.
Ma'am Lara.
Lara.
Lara. Lara.
Okay.
You already recorded, yeah?
Yeah.
I love recordings because then
So,
you can check
This is
it
for
again.
Yes,
the
repeat.
booklet you can keep here. You can see all the type of procedures, the ingredients, everything. So consider it like as a reference for you. You know, whenever you need anything. Did you get my number, my dear?
Yes.
Yeah, I will.
Great. So if you have any questions, you can always talk to me. If I can answer you directly, or I can then ask Hazel as well.
What?
Okay.
Sorry, what this company?
Play skin.
Please skin only. The name of company? From where?
Gulf Pharmacy. We're
Okay.
called Gulf Pharmacy.
Gulf
That is
Pharmacy.
Skin is
distributed.
from where?
Turkey.
Play skin is
That's
from
what I know.
Turkey, but it is
Istanbul,
produced
yeah.
in Spanish laboratories.
Okay.
So made in Spain, but Turkish brand made in Spain.
Belongs to. I think Apple is skipping work. You're
Should
ready.
we laugh
Yeah,
now?
exactly. You wanna come out? You wanna get up?
It's hard, I know.